we're going to learn about this wonderful thing called the cervix. So the cervix is the bottom piece of the uterus. So here's our uterus. This is our cervix down here. Now, you might be familiar with the cervix as the part that needs to dilate, right? I'm 4 centimeters dilated. That means the cervix is open 4 centimeters. It opens up to allow the baby to come out. But before the cervix can dilate, the cervix has some really important other jobs that come first. So let's learn about this cervix. So we're going to use this little piece of Play-doh as our cervix, and if you've got Play-doh with you, go ahead and grab it, and I want you to shape it into like a marshmallow shape, about the size of a marshmallow. You can even put some little indents in the top and in the bottom of that, right, to kind of demonstrate like that there's an opening in there. And this is where the mucus plug hangs out, inside that cervix, right in there. And as this cervix starts to do its changes, sometimes that mucus plug loses its grip and it falls out, and that usually happens somewhere within about 2 weeks of birth. So if you notice that you lose that mucus plug, that does not mean you're in labor. That simply means your body's doing what it needs to do to prepare for birth sometime within the next 2 weeks. All right, back to cervix. All right, so we've got this little marshmallow looking shape. So let me talk to you about what your cervix feels like. So take your finger and touch your forehead. You will feel it's really firm. And that's what your cervix feels like right now. So if you are in that 3rd trimester of pregnancy, your cervix feels like this. As you get closer to the birth of the baby, your cervix is going to get a little softer, and it's going to feel more like the tip of your nose. So go ahead and feel from your forehead to the tip of your nose and feel those changes. That cervix is starting to get softer. Once we start to add some hormone called prostaglandin, prostaglandin is what helps to make that cervix nice and soft. And once we get some contractions going, your cervix is going to feel more like your lip, right? Nice and soft and squishy. And that's a cervix that can do some changes. Now, these process of getting softer is going to happen in its own good time, according to what your cervix needs and according to what your labor may or may not look like. And so this is not something that happens on a specific timeline. It's very individual. Just know that the first thing that needs to happen is your cervix needs to get softer, because a cervix that feels like this cannot dilate. It's too firm. The next thing that's going to happen is your cervix is going to change its position. So if this is the bottom part of the cervix, right now that cervix is pointing towards your back. As labor approaches, it's going to move forward and point more towards your front. So let me do it this way. Right now it's pointing towards your back. It's going to move forward and line up with the vagina and be pointing more towards your front. Now, sometimes providers may offer to do a cervical exam in the last few weeks of pregnancy. If for some reason you do agree to having that cervical exam, and you feel your provider really reaching up in there, and maybe they say the words to you, oh, your cervix is very posterior, please know that that's where your cervix is supposed to be. If you're not in labor yet, your cervix is going to be posterior. As you get closer, it will move forward. And you could be very posterior at 9 o'clock in the morning during the exam, and by 3 o'clock in the afternoon, your cervix could have moved forward. So know that that's going to change. It doesn't really give us any information that's relevant at the time of the exam. Okay, so 1, get softer, 2, move forward. The next thing that has to happen once your cervix is agreeable to making more change, then this has to get thinner. So right now, this cervix is too thick. it can't dilate. I can't open it up. It just doesn't work, right? Even if you pull on it. Well, and if you pull on it, you can actually see what's happening. Once I pull on it, it's starting to get a little bit thinner. So this is called effacement. That's what the fancy word means for thinning out. Your provider during labor, your provider is going to measure your effacement. It's measured in percentages. So this cervix right here is not effaced at all. It hasn't undergone that process yet. And so we call this 0% effaced because zero hasn't done anything yet. But with some contractions, we'll see that this effacement starts to happen, right? So if you're using some Play-doh along with us, go ahead and give your cervix some contractions, and let's get it a little thin. You can actually pinch down the middle here to make some dilation start to happen, but you can see it really isn't dilating yet because it's still too thick to be able to do that. The cervix now is about 50% effaced, so it's halfway there. You should know that this is the part that takes the most time, particularly if you are a first-time person giving birth. If you've not given birth before, then the large majority of your labor is going to be spent just thinning that cervix out. Sometimes with second and third babies, this process goes a little bit faster. But again, every labor and every birth is completely different. And so we are not going to make predictions about how fast or how slow somebody's labor is going to go. That's the surest way to find out that we're wrong. Okay, now we're about 75% effaced, and look what's happening. We are starting to get a little bit of dilation right here in the middle because we are now thinning out some more. All right, so some more contractions. When we talk stages of labor, this is stage 1 of labor. And this is early labor. This is what happens for most of you will probably happen at home because it won't be time to go into your place of birth yet. If you are a candidate for a medical induction, this is what happens when we need to start an induction. We need to start with getting that cervix favorable and ready. All right, now let's take a look at this beautiful cervix. It is really, really thin. We've got more dilation happening here, right? And this is now really floppy, and it is like thin, almost like a t-shirt thin, right? This cervix is now 100% effaced. It has completed all the thinning process. So now the 4th step can happen, which is dilation. Now this cervix can start to open up more on its own. And remember, as those contractions are pulling and pulling and pulling in the uterine fibers and all that muscle tissue, it's going to start pulling open and dilating that cervix. Okay, so take your 2 fingers, go ahead and touch this cervix here in the middle. You'll see when you touch it, it moves, right? It's very floppy. It's hard to kind of grab a hold of without moving it. How many centimeters dilated do you think this is? Now, during labor, your provider will probably try to measure your dilation. So they're doing several measurements. They're feeling where the baby's head is in relation to those ischial spines that we've talked about. They are going to try to feel how thin this cervix is. So they're measuring the effacement in percentages. And then they're also going to measure how dilated you are in centimeters. Now, they don't go in there with a ruler. It is not an accurate measurement. It is very subjective. So what this feels like to one provider might feel slightly different to another provider. If the cervix is not exactly in a circle, maybe it's pulled back a little bit more. Are we going this way? Are we trying to feel all the way around? So you will probably have a cervical check to establish your baseline. Like when you join your provider, whether that's at a birth center or whether that is in a hospital, or when your midwife comes to your home, wherever you're giving birth, your provider may want to check your cervix and say, where are you right now? And then sometimes before you start pushing, your provider might want to check and make sure that there is no cervix left so that we aren't damaging that cervix. In between those two times, your provider really doesn't need to check unless there's a concern. So we don't need to see, randomly where you are along the birth process. In fact, every time somebody puts their fingers inside to check the cervix, we're introducing more and more opportunities for bacteria and infection. So less cervical exams are better to be able to prevent that infection. Now, let's say you've been in labor for a really long time or something doesn't seem quite right. It would be appropriate for your provider at that point to check the cervix to see if there's been any change or gather some additional information. Other than that, we really shouldn't be putting you on a time clock and checking that cervix. Number one, it's uncomfortable, and number two, it's not really the best in the best interest when we are talking about the risk of introducing infection. Now, sometimes I will hear from people that tell me that I'm just so curious. I just want to know how far dilated I am. I will tell you that if you are of the mindset that I just want to know how far dilated I am, it's never going to be a number that you want to hear. So it takes a really long time to thin out this cervix. Many hours, maybe 4, 5, 6, 7, 8 or more hours to get it thin. And by the time it's thin, it's only dilated a tiny little bit, usually, right? And so you might be in labor for a while and you go, I just want to know. And your provider checks and they say you're 1 centimeter dilated. That can really affect your psyche. That can be really defeating if you're not giving your cervix all the credit that it deserves for going through all that thinning and softening and moving that it needs to go through. So mindset, if you're thinking that you want to know, it's probably not going to be a number that you want to hear. Because if you were really dilated, right, you've gone through all this labor, you've had all these contractions, you're really making some good progress in terms of dilation, this person wouldn't find it probably difficult to tolerate a cervical check because you're active now. You're in a very active labor pattern. Your uterus is working hard. Your concentration, your focus is on comfort at this point. So the thought of lying down, holding still while somebody checks the cervix is not the most enjoyable thing. So keep that in mind when we're talking about that cervix.